Hello, everyone. Today, Group 6 will be presenting a patient who has hypertension. So this is our table of contents in which we will be discussing all 7 of these aspects. But to firstly start off, we'll talk about the patient's background. Mr. Mike Wazowski is a 57-year-old male who wants to establish himself as a patient for primary care. There is a 5-year history of hypertension for which he plans to be trialed on metoprolol, has not started, but plans. He also has a family history of hypertension and cardiovascular disease in which his father had a heart attack at the age of 60. Other than that, there are no other significant medical conditions. So upon physical examination, we see that Mike's blood pressure is measured at 158/94, which is elevated. And by using the values presented by his height and weight, we're able to calculate his BMI, which is 29, indicating that he is overweight, almost obese, not yet though. Other than that, his physical examinations for the most part are within normal limits. We see that his creatinine levels normal, and we see that his hemoglobin A1C is 5.5, which is under the pre-diabetic range. Typically 5.7 is considered pre-diabetic, so he is reaching there. Total cholesterol under 200, which is completely normal. Triglycerides, HDL, and LDL are all normal. His HDL levels, however, is 40. It is typically supposed to be under that level, yes, but he is kind of reaching under. So now talking about his social history, we see that Mr. Wazowski works as an accountant and has a sedentary lifestyle with minimal physical activity in his day-to-day life. He does not smoke, but he does occasionally drink on weekends during Sunday NFL games. And the patient was asked to present us with a 24-hour food log in order to really understand his dietary habits and to see what he's eating on a day-to-day. So with that, we see that for his breakfast, he usually skips breakfast due to a morning rush and only has a cup of coffee. For lunch, he has a sandwich with processed deli meats, white bread, and mayonnaise from Panera, along with a bag of chips. For dinner, he has spaghetti with meat sauce, garlic bread, and a small side salad from Olive Garden, along with a glass of red wine. And for snacks, he has a handful of salted peanuts and a bag of chips while watching TV in the evening. Now, the reason why we have quotation marks around handful is because the definition of handful for each and every patient or each and every individual can vary. For some, it may be 3 to 5. For others, it may be 10 to 12. Therefore, handful is not this exact quantitative measure. It's more so what someone may think is a handful, however, could be a lot.
So some healthy food options that we would recommend to our patient, Mike Wazowski, would be some fruits, like incorporating a lot of bananas, berries, avocados, peaches, kiwis, just because they're all great sources of potassium, and that would help lower blood pressure. And also we recommend incorporating these, substitutes into like daily cooking, such as like oatmeal, quinoa, used salmon, kale, spinach, and arugula are great bases. And then also we recommend using, olive oil, garlic, reduce your salt, and low-fat dairy products while cooking. And these are all some great options that you can use on a daily basis to lower your blood pressure. And then in terms of foods to avoid, we recommend avoiding processed meats just because processed meats like, bacon or hot dogs or red meat, they just have like a lot of sodium, especially like the processed, canned, packaged items. And then also avoid high sodium items. Like I said before, you want to avoid those chips, those French fries, those packaged snacks or fast food. And in terms of like drinks, try your best to, avoid soda, energy drinks, sweetened beverages, and alcohol, and find like healthier alternatives that have lower sodium in them. Like kombucha is a great alternative. And these are some lifestyle improvements that we recommend our patient Mike Wazowski to follow. We know that he has like a busy, lifestyle and he's busy with like work and he sits most of the day. So these are just some like tips and tricks that we recommend. Like meal prep, meal planning, the mornings are so busy. So like, once a week or like the day before, try your best to just like plan ahead, prepare breakfast cups. You can incorporate low-fat yogurt, oatmeal and berries, and also make modifications and substitutions. Like replace your morning caffeine or coffee with like a healthy green tea or substitute those like the salty snacks like the salty peanuts with some vegetables or dip, and also reduce the alcohol that he has like on the weekends with like a low sodium juice or low processed juice or anything that isn't too processed and has low sodium. And also we recommend incorporating more exercise. We know that he does like sit at the desk all day just because work, but try to maybe incorporate a standing desk or take walking breaks. Find a buddy to go on like walking breaks with, taking breaks, like going outside, or find a local gym or like a fitness program that you can join on the weekends. And then also find a new like Sunday game routine. Like I know that like on Sunday when we see those games, we're drinking, the alcohol and like we have all those yummy snacks, but maybe we could replace the alcohol with, like a healthy snack. We have like carrot, celery, a nice dip, or maybe replace the alcohol with, lemon water or kombucha, something that's less processed and has lower sodium because we want to keep our blood pressure at a good level.
So for exercise, we recommend that Mr. Wazowski commit to 150 minutes of cardio each week, which equates to 30 minutes daily at 5 times per week. Create a routine. We advise him to create a routine and be consistent and do it how you like so it can be achieved by walking, running, cycling, dancing, indoor or outdoor, whichever he prefers, but preferably outdoor. Also stretching. We advise Mr. Wazowski to do
All right, so for the meal recommendations for Mr. Wazowski,
light stretching in the morning once he wakes up and at night before bed.
Juice for option 2. If Mr.
Getting
Wazowski
into
is
yoga,
without
finding
time,
a
doesn't have
local
much time,
beginner
he
yoga
can opt for
class or
freshly
local
cut fruit and some
instructors in
oatmeal
his
with water.
town.
For lunch, we have a
Strength
grilled
training at
skinless
least
chicken
1 to
breast
2 times per
with brown
week.
rice and black
We
beans
advise
meal,
Mr. Wazowski to
with
start
small
off
fruit cup on the
slowly
side and berry
and
juice.
increase
For option
weight
2, we have
gradually.
grilled tofu sandwich with whole wheat
This can
bread topped with
include
lettuce,
weightlifting,
tomatoes, and
squatting,
mayonnaise,
push-ups,
along with sparkling water.
pull-ups.
Now, for his dinner options, we recommend a grilled salmon with steamed broccoli and roasted sweet potatoes alongside green tea. And for option 2, we have a quinoa salad topped with onions, tomatoes, and cucumbers, along with olive oil and a side of glass of wine to drink.
For snacks, we offer some recommendations of unsalted nuts. Since Mr. Wazowski enjoys peanuts, we just recommend unsalted. We have cashews, almonds, peanuts, also peanut butter banana smoothie with peanut butter, banana, and almond milk, alongside fresh fruits, strawberries, bananas, pears, all good.
Have for our Mediterranean score, we have option 1 breakfast. We have whole grain pancakes and we have orange juice. So we get a total score of 2. The egg whites doesn't count for anything. For option 2, for our breakfast, we have fresh cut fruits. Although we have 2 different fruits in general count for 1. We have oatmeal. And so that gives us a total score of 2. For our lunch, we have the grilled skinless chicken breast with brown rice and black beans. That gives us a total score of 2. Small cup of fruits, which counts for 1. Berry juice, I lump that into juices, so that counts as a total score of 3. For option 2, we have grilled tofu sandwich with whole wheat bread. That counts for 2 points. And vegetable toppings, that counts as 1. And sparkling water, because it
This
has
is our
fruit
blood
flavor,
pressure
that counts
log.
for 1. So we have a
Patients are
total
advised to
score
measure their
of
blood pressure
4.
twice a day, once in the morning and once in the late
For
afternoon.
dinner, we have the grilled
Our
salmon
log
with
provides them
steamed
with the
broccoli and
proper
roasted sweet
instructions to
potatoes.
follow in order to
That's a total
obtain an
score
accurate
of 3.
measurement.
And
Patients
green
are
tea,
advised to bring their log
score of
in during
1.
their visit
So
with their
that gives
physician
us a total
to
score of
discuss
4.
recommended
And
intervention
option
that is
2,
specific
for
to the
dinner, we
patient.
have a quinoa
Everybody's day-to-day
salad.
life is
That's
different,
a
and staying healthy is hard.
Mediterranean
However, small
diet
changes can
score
go a
of
long
2.
way
And we have
when opting
toppings,
for a
which is
healthier
a mixture of
lifestyle.
vegetables,
This
although we have
handout
3
here
different
allows for
vegetables.
patients to
That
see
counts as
what
just
small
1.
changes they can
And we
make
have
in
olive
their
oil
daily
that goes
activity
towards
and
our fats.
food
And
intake
finally,
in
we
order
have some
to
wine.
lower their blood pressure
So
and
that gives us
maintain
a
an
total
overall healthier
score
lifestyle.
for
Life can be
5 out of
demanding and
9.
staying active is difficult at times.
Some
However,
of the
it is
snacks,
important to incorporate at least
we
30
want to go
minutes
ahead
of
and
moderate
try to eat
exercise in
healthy
our
snacks. We
day.
have
This
unsalted,
handout is a great
different
resource
arrays
for
of
patients to know
peanuts. So
what to
that's going to give us a
incorporate.
total score
The
of 1.
stretching
Different
exercise
snack option is
infograph, for
peanut
example,
butter and
demonstrates
banana
different
smoothie.
exercises